All right. So this is this might be potentially a continual thing, like this some sort of podcast, but I thought this is a pretty important time to get some good information about the coronavirus situation that's obviously affecting a lot of people. And I wanted to focus this on particularly on the impact coronavirus would have on the jiu-jitsu community. And because I think there's a lot of information out there about the coronavirus, but very little, or almost nothing about what people in jiu-jitsu should be doing right now. So actually I've got a guest on, Dr. Jérôme Fennell. Jérôme is head of infectious disease control at the hospital Tallaght. Did I say that correctly?
I suppose I'm head of infection control at Tallaght University Hospital,
yeah,
in Dublin.
And Jérôme he actually I reached out to Jérôme because he used to train with us back in Melbourne. He was doing a very similar form of work. At which hospital were you at when you're in Melbourne?
I was in the Alfred, but I was mostly there for my wife's career rather than mine. But
fair enough. So Jerome's obviously jiu-jitsu purple belt, correct?
That's right. Yeah.
Yes. Yeah. Someone who is very knowledgeable in the area of infectious disease control and is directly involved in managing and dealing with this current pandemic we have, and also trains jiu-jitsu. So I think very well qualified to answer any questions on this topic. So anyway, Jérôme, do you want to quickly introduce yourself, sort of your background?
Okay, so I guess thanks for having me. Like we said, my jiu-jitsu background was I got my purple belt from John Kavanagh a couple of years ago, and then moved to a club here, Gracie Baja in Sandyford. But in terms of medical knowledge, so what I am is a clinical microbiologist, and that's a specialty that doesn't exist in some countries. So it's kind of a mixture of things. So I do some infection control. I do oversee the lab, and along with my colleagues, we see kind of complicated infections that the usual doctors are struggling with, either due to allergies or various other issues. So it's a little bit like an infectious disease clinician, which most people would be more familiar with, but not exactly. They do a lot more kind of tropical medicine and would have more of a focus on hepatitis and HIV. So I suppose I'm dealing more with superbugs and that kind of thing. And there's more of a lab base and more of an infection control connection as well.
Right. And what's your role currently in this COVID situation?
So I don't want to talk too much about my own hospital, my settings, but I am head of infection control. But in fairness, the whole thing is being led by hospital management. And there's been a lot of planning over the last 2 months, a lot of meetings, a lot of PPE has been ordered, a lot of hand gel has been ordered. We've done a lot of run-throughs and practice runs, and now the cases are here. We're dealing with them.
All right. Thanks, Jérôme. Let's go into. I'm just going to go over kind of a brief overview of what we want to talk about before we get into those specific questions. So, firstly, we'll try to cover how bad is this situation. So, just your kind of thoughts on that. How severe is this disease? How concerned do people need to be? I want to cover when do you think people will be able. I mean, most gyms now, I think, around the world are shut. There might be some still open. We'll talk about that. But like, if or when do you think would be the case that academies might be able to reopen? Do you have any when that eventually does occur? Do you have any suggestions for how people can better protect themselves against this virus? And I guess also what it might look like, how will this process of returning to jiu-jitsu actually appear? Is it going to be everyone comes back at once, or are we going to have people who are have had the disease and recovered who kind of return first, and then it kind of trickles in? Or I guess I have no idea what that will actually look like. So, that's we've got some more questions in there, but that's the general kind of outline of it. So let's start out with how severe this disease this
I suppose
disease is.
the first thing I'd just like to say is that I think the phrase everybody's using is this is a very fluid situation. This is a new situation for all of us. It's possibly a once in a century pandemic. It's certainly nothing like any outbreak I've ever had to deal with before. It's just on a completely different level. So we are learning things all the time, and it's certainly going, a lot of things we'll say now will probably be based on our current level of knowledge, but that could all change tomorrow as new things become apparent. So it kind of comes with a health warning that there's no absolute experts in this anymore, or yet. I'm sure that'll happen with time. But we're still learning very much about, it's incredible to think this virus was unknown 3 months ago. And now we have already sequenced it. We know what the receptor is. We can grow it in cells. So it's a lot of things have happened since, but we're still learning a lot about it as well in terms of the epidemiology.
Yeah, I think that's an important point. And I should say we're recording on just because literally things change so quickly, we're recording on the 23rd of March right now. I think I should say that because, if you watch in 1 week's time, you probably, I'm saying this because I think if you gave the message I imagine you might be giving now, if you gave that to us 3 weeks ago, people probably would have thought, who is this, this guy with the tinfoil hat on, telling us that we need to be worried about this disease. I think that was the general consensus of the world very short time ago. I mean, it was probably 3 weeks ago. I was in Italy myself, in Rome while it was just starting in Milan to be bad. And we kind of canceled our trip to Milan. But I remember
probably a wise move.
Walking around and people did not care at all about it then, and it's just changed so much since then. So obviously you were probably a lot more concerned. I was a bit more concerned as well because I'd sort of been reading and following it pretty closely. But I
suppose initially we thought it would be like another SARS situation that would blow over, but after a couple of weeks we kind of realized this is much more serious than SARS. The numbers are much bigger, and it seems to be spreading a lot more. It's probably mid-January we kind of realized this could be serious, and I can imagine with the amount of physical contact, the amount of people would want to roll with you when you're on a European tour, that it was a pretty risky endeavor, and it's probably a good thing you got out when you did.
It was how fast it happened was pretty amazing, because I was monitoring it, and I saw Korea was having an outbreak, and there wasn't really anything to worry about. When we left on the Wednesday, I don't think Italy had even been, there might've been the odd case, but I guess you start getting worried when you hear about community spread, right? Once you realize that it's out of, it's not contact traceable necessarily. And that probably didn't happen until the Saturday, and we were meant to do the seminar. We were in Dubai or Istanbul then. We were meant to do the seminar on the Wednesday, and then within 2 days, gyms had been shut. We'd already messaged them saying, hey, we might not actually be able to come to your seminar. And then the next day they said, gyms are shut, and we were actually kind of happy with that to get out of there. But because I did not want to be the person that would go and catch the disease and then go and roll with 50 people in Spain, then France, then Austria, and then head back home and do the same thing. So
exactly. I was thinking about this. If you could paint somebody red and bring them into a no-gis class and let them roll with everybody, and then just see all the red everywhere afterwards and see how things spread and how much contact we have with each other, I think it's phenomenal. And jiu-jitsu by its nature has got to be one of the worst possible things you can do in terms of contact with other people and contact with multiple people in rapid succession. So unfortunately, it's probably going to be one of the last things we can go back to.
Yes. And one of the most alarming things I think I read in South Korea, this might have been about a month ago, but there was a Zumba class, which I believe had about 101 members, or Academy had 101 members. And I think over 90 participants in that class tested positive to it. And I thought, well, that Zumba's nothing like jiu-jitsu. And I think that's probably why maybe our concern being in Melbourne, once we started getting community outbreak for our own gym, we were expecting once there was communal outbreak that schools would get shut. And that's what we were thinking. Okay, when they shut the schools, because schools kind of like kids are going to touch each other and play. We're thinking that's when we'll shut the gym. And then we started realizing that at least in Australia, the government kind of had a different idea about schools where, for whatever reason, like there was reasons other than the safety other than about the spread, about like, pulling parents away from work and so on, and some other. They also, I saw them today saying that there's no evidence that children are a major spreader of this or something. And I'm like, well, anyway, I think the reasons they were giving for schools, I have no idea if that's true or not, but that's what our government's been saying. But the reason they were giving for schools didn't really apply to jiu-jitsu. Like in the end, it's a hobby, and it's something you actually can just avoid, and still for most people just continue their regular life otherwise. So yeah. All right.
So I mean, the kids' situation is interesting. It's, I suppose, unlike a lot of viruses, the kids seem to be, or like some other viruses, the kids seem to be almost not affected. But I think there's been recent papers that have shown that kids do get the virus, they do shed the virus, they just don't have a whole lot of symptoms. And we're not sure whether that's because they are exposed to all the other coronaviruses that are out there and have a better immune response, or maybe they don't have the same level of expression of the receptor or something like that, and they're not as badly infected. Or so we're not really sure why that is. But I think it's certainly been shown that kids can shed the virus, even though they may not be that symptomatic.
Yeah, I'm not sure what our government's doing, but we'll leave it away from that. So let's the first thing I wanted to go through was I kind of wanted to just run through some of because right now there are some people who literally just shut their academy today, I believe, in Melbourne. Okay. But I believe if the government hadn't enforced that, they would still be open and still have people rolling. And there's people who might still be trying to find ways to train otherwise. So I think it's important that we get some good information about whether that's a good idea. But I wanted to kind of go through I actually thought if we go through their rationale and we could kind of break down whether
sorry, I think you kind of asked him. We kind of got sidetracked about how severe this is going to be.
Sorry. Yeah. Mate, do you want to go about that first?
You want to start with that?
Yeah.
I mean, first of all, again, I'm no expert. This is all uncharted territory. But everything I've read has suggested that this is not going to be good. When you look at the projected percentage of the population that's going to be infected, it's regularly between 30 and 70% of the population. So even a 1% mortality on that kind of basis is enormous, and I think people who don't understand that there is no pre-existing immunity to this virus is going to spread quite easily, so I think it's deeply responsible for gym owners. Now I understand they have a financial reason that they might want to stay open long term. But I think when you have a susceptible population, seriously close contact, a lot of contact with the virus that has that level of infectivity and frankly mortality, it's putting themselves at risk. It's putting their parents at risk, their grandparents at risk, their vulnerable contacts, their friend with diabetes or their friend with a transplant or HIV or whatever. So I think it's not just a risk to themselves and their contacts. As the numbers take off, the healthcare systems are really going to be put under an awful lot of pressure and possibly be overwhelmed, depending what country you're in and how well they can cope. But if they are overwhelmed, the healthcare workers are going to be the front line, and they're going to be the ones put at risk by behavior like this. And it's really hard, and we've seen the videos from Italy. If you're in PPE all day, it's hot, after hours of working, possibly because some of your colleagues are down with this as well and not able to come to work. You're going to be dealing with a really difficult situation and more likely to make mistakes with your PPE and contaminate yourself. So I think I'm not sure how long people will be able to maintain these kind of levels of exclusion and social distancing and closing gyms, but the longer the better. And if you don't, it's possibly putting yourself at risk. It's probably exacerbating
family
and exacerbating the situation for the healthcare system.
Yeah, it's so I mean, actually, maybe we talk about the case fatality rate, because I think that's something that I think people have all these wild ideas about that.
Yeah.
It seems like the lower estimate from most of the experts that I've seen, you can tell me if this is correct or not, but from generally the lower estimate, which people tend to kind of pick the upper or lower instead of choosing the mean, which or the kind of in the middle, which I think is probably a more sensible approach. But the lower seems to be like 0.6% is a figure I see coming around. But I also think like that's like at best case from the sounds of it, and also that seems to be related to whether your healthcare system is actually functioning correctly. Do you have any thoughts on?
There's no doubt if your intensive care units are overwhelmed and you don't have enough ventilators, there's going to be a much higher mortality rate. And I mean, that's probably what's happened in Italy. I've heard everything from 0.5% to 6 or 7%. And again, it's going to depend on the situation. I think we don't really know for definite yet. Possibly in Korea, where they've done an awful lot of screening and contact tracing, I think they may be the best country in terms of knowing what the true infection rates are, because they have such high levels of screening. And I think they're coming out at something like 0.5% or thereabouts. But that's still like 10 or 20 times more than a flu outbreak. And 0.5% of 50% of the world's population is still an enormous number.
Yeah, and I think it's not just it's not just the percent that die, but also like this thing seems to take like 3 weeks for people to, like when someone gets it bad, it takes they get hospitalized for a long time, and that kind of overwhelms the hospitals a bit more. Is that correct, or it seems to?
Yeah. I mean, I've heard a normal case is about 2 weeks. A bad case, you're out for 5 or 6 weeks. Now, you're probably not in intensive care for all that, but the severe cases would certainly spend an awful lot of time in hospital.
Yeah, I mean, so in Italy right now, I believe it's it's over 5% now there. Like if you're tested positive, and then from the people who have actually tested positive, it's over 5% of them
which is enormous now.
Have died. Yeah.
And I know some people are taking solace in the fact that I think the average age of the Italian deaths is extremely high because they have an older population. But there are still plenty of people in their 30s and 40s who have died as well.
And also, I think adding to that is if you've got, like the doctors, they've got an older person and a younger person, and they're now having to decide who to save. They're probably going to actually put their attention to the younger person now too, so that'll skew those results even more.
And I think it's sad, but it's true. I think every hospital in the world that is facing this has had a discussion about what criteria they're going to use to decide who gets a ventilator and who doesn't. It's going to be based on probably age and number of systems failing and past medical history. And it's probably the single biggest determinant of whether you get a ventilator or not is probably going to be what they think, how long you'll spend on it. If they think you'll be on it for a week, you're much more likely to get it than somebody who they think will be on it for 3 weeks, because they can turn around more people. So I think I heard there was a tweet from Spain today about some clinician who said they've just decided not to intubate the over 65s, which is scary. And this is not something we've ever had to do before or ever even thought of before this situation.
Yeah, it's worrying. All right. So can we get into, I guess we kind of touched on this already, but some of the reasons why someone who, what would be the rationale that someone who wanted to continue to run a school would be using, and just see if we can kind of break that down a little bit as to, so the first one, I actually had a few points. So they either believe it's not as bad as everyone's saying, it's less people, they think it's kind of overhyped, which I think we just discussed there, even at the lowest margin, which is probably not accurate, it's probably somewhere a bit above that, but even at the lowest margin, that's still very, very severe disease that you do not want to be running a jiu-jitsu school. If there's a chance people are catching it, I believe. There's the next one. This is probably more relevant to Australia, but I think, and I kind of touched on this earlier, but that people were waiting for schools to close. They were basically putting the same analogy that, kids going to school is the same as people going and doing jiu-jitsu, and therefore if the government doesn't stop the kids going to school, we shouldn't stop doing jiu-jitsu. Do you have any extra thoughts apart from that just being I kind of think as I said earlier, I think the government's rationale for that was quite different to the idea that it's that they were saying it might not be spreading through kids or something. I think it's obviously quite obvious in jiu-jitsu that it will be spreading if it gets in there.
I suppose you can see how education is possibly more important than jiu-jitsu, but I can see the way they're thinking. But like we said, children are secreting it at high levels. I suppose in a jiu-jitsu school you have all ages, so you probably have a more vulnerable population there than you do with the kids. And who knows who's on steroids for Crohn's or whatever else in your club. You don't know the full risk factors of all the your students. So sorry, I just
that's right. Good enough for me. I think it's quite that kind of self-explanatory. I guess I made a little post about this, but I said, if the on Facebook, but if the government knew what jiu-jitsu was, I don't think they would be allowing it to happen. I think they just don't know what it is, so they've kind of lumped jiu-jitsu in with gyms, which is I think it's quite different going to the gym and using weights where you can potentially wipe down the which is still probably, I mean, they've banned that now anyway, but the jiu-jitsu is probably
like I said earlier, if you think of the amount of physical contact, particularly in no-gi, when people are sweating all over each other and then moving on to the next person 5 minutes later and then so on for an hour and a half or whatever it is, the amount of contact has got to be more than just about anything else I can imagine that's legal.
I agree.
Possibly wrestling might be similar. And particularly if you're sandwiched between your opponent and the ground, like there's no room for his breathing to go except for on you. And I think some gym owners are saying that keeping their places really clean.
The latest one the latest one I've seen quite a lot of. There's this certificate of like compliance, not compliance, like you can do like a COVID hygiene certificate or something.
Okay.
Yeah, and a lot of people have been posting, like doing that and posting it up. But I'm not sure I'm pretty sure on that it would say don't go within 2 meters of people. I'm not sure, but I haven't. It
doesn't matter how clean your floor is if somebody is, sitting on you and breathing on you and sweating on you and vice versa. The floor can be absolutely immaculate. It's not going to stop you getting the organisms.
So let's go on to the next point I said was going to make. So some people would say, like, I imagine some people might be thinking that, what's the difference? If you're going to get it, you're going to get it. So whether it's through jiu-jitsu or out on the street, I mean, my rationale would be, well, if you get it and you go to jiu-jitsu, you're probably going to spread it to a lot of people. Like potentially, I'd be thinking in the at least in the double digits or potentially more than that.
I can't remember specifics, but there was an example, was it patient 31 or something in Korea who basically flouted all the rules of social distancing, who was a positive and was linked to an absolutely enormous number of cases. And, I think we can see from the curves that this is going exponential. So if you give it to one person, and then that just multiplies from there, or if you give it to 3 people and then they give it to 3 people, it just can mushroom pretty quickly. And before you know it, your whole gym has been affected, or Zumba club or whatever.
I think actually, I think it's everyone's responsibility to do their best not to catch it. Technically you could, if you went back and you found the guy that ate the bat or whatever he did in the first place,
Yeah,
however it started. Like, if you could find him, like you could say that guy, that person, or guy or girl, whoever it was, is potentially responsible for what could be, I don't, who knows how many deaths. But
yeah,
at the same time, that wasn't like a they weren't educated on the idea of what they were doing could
yeah,
lead to this. Whereas if you kind of go out of your way, like you would ignore the
yeah.
advice of the government or the general kind of distancing guidelines, and you catch it, and then that leads to people getting infected and potentially dying. Like, it's quite irresponsible, and you actually kind of do have some causal pattern in people's deaths. Obviously, if
Absolutely.
you're doing the right things and somehow you catch it anyway, I think that's
And I think,
morally okay.
big,
But
because we have, nothing guaranteed to help really in terms of treatment. We have no vaccine, we have no immunity. We're left with these social isolation measures to try and stop the spread of this. And we're really playing for time. If the health system gets overwhelmed, it's crucial that we try and delay that as much as possible to give us time to try and develop those treatments. And eventually a vaccine will hopefully be here in a year or a year and a half's time. So the longer you delay the spike of that curve and the overwhelming of the health service, the more time it gets us to ramp up testing,
prepare.
get more PPE, replace the hand gel stocks, and get ready and increase capacity in the hospitals, and get ventilators in, etc.
Next point I had, like, some people might think that they weren't going to catch it. Sorry, it's not prevalent in society enough. Like, the risk was too low to get into it. I imagine, like, I mean, at a certain point, it's a very hard line to draw. Like, when does it suddenly become like, oh, actually, we might get this in our gym? Like, when there's one case in your country, it's probably extremely low.
Yeah.
Once you start seeing communal spread, but if it's in another state, is it still low? Like, that's probably the harder one to for people to.
I suppose that makes sense in a way, but the reality is the testing isn't up and running yet. You don't know what the true prevalence in your population is yet. I think most countries have struggled to get testing up to high enough levels, and a lot of them are concentrating on testing hospital inpatients or people coming into the ERs rather than community screening. I think in time, as capacity increases, there will be a lot more community screening and contact tracing and that kind of thing. But I think part of the problem is all these countries are competing for the same machines, the same reagents, same license buffer, and as a result, we're struggling to test the number of people we need to test.
Yeah, I think we're leaving Australia, it's about 5 days behind, and at the same time, there's so many people who would not fit who may have it that don't fit the criteria to get the test. So we really don't know the numbers. I think people look at a number that now is over 1,000, which I think is enough of a worry. But like, it could be 4 or 5 times that, who knows, or even more. I have no idea.
I mean, I think Ireland and Australia are quite similar in terms of numbers at the moment. I think we're going to break 1,000 tomorrow, and you guys are
we just recently
that.
Yeah.
But I suppose you do have I think it's about 5 times the population of Ireland. So I mean, it's hard to know
per
whether
capita.
we have, whether we have 5 times more cases per capita then or not. Sorry, where was I going to go with that? But I suppose we just don't really know the true prevalence.
Yeah. What do you? I mean, this one I think is you've already kind of discussed this, but the people who would say that we're going to get it anyway, so what does it matter? I guess that's about flattening the curve, right? Like, if everyone gets it early on when there's no capacity to, it's terrible.
Then okay, you're going to have a massive spike. You're going to have 20 times more people looking for ICU beds than you have capacity for. You have massive mortality, and that's what all these measures are trying to avoid, is by, like you said, trying to flatten that curve so that we can at least try and maintain some kind of health service. And it's important to think that it's not just the care of the COVID patients. If your ICU is full of COVID patients, you can't deal with the car crashes, you can't deal with the overdoses, you can't deal with all the other things that people come in with to intensive care.
Yeah, that's a worry.
Mm.
Do anything risky
Yeah,
outside of
exactly.
catching the
Yeah,
virus as well. So,
yeah.
um, all right. And then I suppose the last one I had written down was people just don't care about anyone except themselves, and that's probably like if that was their rationale for continuing to train, as in like, I don't care if anyone else gets it, it's just about me, then you probably can't give a good reason to convince them otherwise, unless it's their family or something. But
Yeah, I
obviously
mean,
that's a pretty quite an immoral stance to take on it, I think. But
absolutely. And,
there's certainly
they
some
need to think
people
about
that are,
their club. They need to think about their club mates, their parents, their grandparents. I think it's not a sensible approach.
yes. All right, so that's probably we kind of talked about how severe this is and whether gyms should be closed. Let's kind of move on a little bit. I had a bunch of questions to ask. We'll try and go through these pretty quick because I think we'll otherwise take a bit too long. Is there any indication as to do you have much knowledge about how many of the younger population are ending up in ICU? I believe some data's come out a lot more recently on that. But you can probably expand on that.
I think I don't have exact figures to hand. I mean, I think it's still probably less than 1%. I mean, it depends what age category you look at, but I think certainly the younger you go, the less the risk. And I think in children, it's almost unheard of. But I think there have been occasional cases, but often they are people who have other underlying comorbidities or cardiac or pulmonary issues. So, I mean, the risk to a person under 30 is probably pretty low. But, when you're talking about the numbers we're talking about, there's still going to be some patients who will be going to ICU and possibly won't come out of it.
And when we say, for those who don't know, ICU is intensive care unit. So that's, it's like pretty much, it's not just going to hospital, it's going to ICU, which is, do you want to, maybe you can expand on what ICU would involve for someone?
I suppose it's like the name says, it's the most intensive care in the hospital. It's the patients who need the most help, who need the most support. I suppose, looking at it from the outside, it's the patient with the most tubes. So you've got patients who are, and having all their various different organ systems supported, whether that's dialysis, whether that's intubation, etc.
Yeah, so it's that's just to clarify for everyone, that's not 1% chance of going to hospital. This is like very severe, where you're needing pretty much constant contact with health professionals just to stay alive, essentially.
Yeah, exactly.
Yeah. So how long do you have a rough estimation for how long this thing is going to go on for?
I think it depends on a lot of factors. So I can't give a definite answer. I mean, nobody knows. I can guess. I think it depends on what the measures each country takes are, how effective those are. And I think the Imperial paper talked about two different approaches, the mitigation approach and the suppression approach. And I think if you go all out for suppression, and I think that's probably China's the example for that, they had devastating numbers, but they, really probably,
we believe, and I think they vastly underreported their numbers, as we're seeing.
Possibly, yeah. But at the same time, they coordinated an incredible response,
for sure.
And they probably can do things that most Western countries can't as well, in terms of making people stay at home. But I think it was a massive logistical exercise, and we saw that hospital going up in 10 days, which I'm not sure too many other countries in the world could have done that. I mean, basically, if you go all out, do everything possible, do all the contact tracing, and I think they had something like, was it 800 5-member teams of contact tracers chasing up all the positives and their contacts in Wuhan. And I think they had apps as well, where people were kind of graded on a traffic light system or something like that. So I think looking at their numbers, I mean, it basically took them about, I think, between 2 months and 3 months to turn this around completely. And I gather things are beginning to return to normal there. So I think if you go all out, that's probably the time frame you're talking about 3 months.
The crazy thing is that I think, well, you can tell me if I'm correct, but if literally everyone in the world, like, or even in Australia, for example, and we had our borders shut, like if everyone just locked down, didn't contact anyone for 3 weeks time or something, like the disease, and obviously the hospitals would have to still be dealing with what they got, but you could actually pretty much get rid of the problem to some extent. And that's why when I see like posts on Facebook, you know, like it's just the one person that doesn't believe it's, you know, a serious issue or something that is going to just keep this thing. I mean, obviously you would need a great big collective effort to do that, and I just don't see it being possible in Western.
If you could laminate everyone or something just to stop them contacting anybody else, and you know, if you had perfect isolation, this would be over in 3 weeks, but that's just not possible.
Yeah, but it's frustrating seeing people kind of like everyone's. I'm very impressed with how many people are taking this seriously in Australia. Like the general consensus is that we need to get on and try and, you know, do our best to stop this. But then there's the occasional person who's not, and they actually do a lot of damage, I think.
Yeah, I mean, one person who doesn't go with the flow can, you know, make a massive difference, unlike one person who just does what they should do.
Yeah, it's not good. So do you have did you have a rough, let's say the way it's going now, like do you feel like 6, 12 or 18 months seem more?
I mean, this is pure guesswork. I don't really know. I would hope the things would be kind of normal within 6 months. Certainly within a year or a year and a half, I would expect normality to have returned. But I suppose we're going to have to see what happens with this virus in the long run. I don't think it's going to go the way of SARS and just disappear completely. I think we'd be very lucky, but I think that's unlikely. And it may just
be seasonal.
It may become seasonal, and you know that might be an issue in Australia when you're heading into your winter. Things might get worse that way, but you know, who knows how much of an effect that's going to have. But there's about 4 other coronaviruses that are seasonal, kind of winter viruses that cause kind of a common cold type thing, and maybe it'll become another one of those. And in general, a lot of viruses would kind of lose their pathogenicity over time. You know, a virus will be more successful if it doesn't eliminate its host and can be spread more often. So, and I suppose the more vulnerable people would disappear as well. So I think in time, I think this will be the worst stage of it.
We have of it.
If it comes back in a year's time or 2 years' time and becomes a seasonal virus, I suppose first of all there'll be a lot more pre-existing immunity in the population. So you know, it's never going to be this bad again, but we have to get through this first.
I did see an article which had me worried, that one by the Imperial College. Did you have that on your screen to bring up, Jerome? Or let's see if we can. Who did some projections that essentially in this study they did some projections that basically they expect kind of on and off lockdowns to try to. Yeah, I can see that. Yeah, and if you scroll down, I think down quite far actually, near the end, they projected these on-off lockdowns. So basically, like we get it under control, and the ICUs are coping. So then we kind of let people get back out to work. But then once we do that, it starts to build up, and we have to
and that's scary. And you know, they're almost kind of trading their measures to the
a little further than this. Here we are. Yeah. So this was like the initial spike on the left, and the blue is like when we put the blue is when you put the lockdown in.
Measures in.
And then it gets rid of it to a certain degree, and then you release the measures so people can actually get the economy going again. But then it spikes again.
Yeah. So I think basically they're predicting when their ICUs are going to be full in 2 weeks' time, they're bringing in the measures again. That's probably being done on and then they have to bring in the measures, and so just trying to look at the time frame there. It looks like it's pretty much a month at a time, and so that wouldn't that wouldn't be, I suppose that's the suppression approach rather than so yeah, no, that would be pretty difficult for everyone financially over the long time frame involved.
I mean,
and I suppose that's going to be another problem as time goes on, is as the economy deteriorates, how long will people be able to tolerate all these measures?
did you want to maybe close that just so I can see your video again?
Oh yeah,
just to,
sure.
Yeah. So, I mean, just for jiu-jitsu gym owners right now, given there's a lot of uncertainty, like, would you recommend them, if they're in a bad financial spot, to start looking for external work, or should they be, like, I mean, should we be preparing for this to potentially last a year? Like, I mean, that's a very real possibility, isn't it? Like,
I think it's probably always wise to have a backup plan. But yeah, and
obviously it's hard to project, but I mean, probably what's the minimum time then? What would be the, like, 4 months?
Best case scenario, you're looking at I think Chinese scenario, which is 2 or 3 months, I think.
Yeah,
which obviously is.
But I just don't think we can do that.
Yeah, I mean, I suppose on an individual level, it's just like, I don't know, having a severe knee injury or something like that. It's, people are just going to have to, work on their flexibility, work on their strength, work on their, watch the competition videos and the instructionals.
Get my BJJ phonetics instructionals.
No. But yeah, I mean, I can understand how hard it's going to be for everyone, but I think.
Yeah, I mean, I still think from my point of view, like, to be honest, it's really hard. Like, it's hard to judge, like, how severe, like how much loss of life is it worth to shut your gym?
Yeah.
Like, I mean, if someone said, if you shut your gym, one extra person lives, is that?
Yeah, and it's
just one extra. Is that?
There's somebody somewhere who's probably figuring all this out, how much a human life is worth for all these measures, and
I mean, it's probably not as easy a question to answer as it sounds, but so, like, at certain points, if it's dragging on for a long time, I see points where the government doesn't know what jiu-jitsu is, and schools start opening again, but we certainly haven't gotten rid of the disease. I don't know if that's it's a pretty.
Hopefully by then there will be a lot more testing, and any cases will be able to be tracked and contacts kind of isolated, and the thing shut down more quickly. So I think the longer this goes on, the better it should become. But obviously that's no consolation when your gym is closed indefinitely.
So can I? Sorry, go on.
No, go ahead.
Can I go through some things that I've seen? Like, I've seen just from jiu-jitsu academies, like, does obviously cleaning the mats would help, but it's still not enough in a scenario like this, is it?
I think. I mean, there is environmental spread. There's contact spread from the environment, but it's much more person-to-person spread. So cleaning the mats will help, but I think you probably still get, I don't know, 80% of your infections from person-to-person spread.
I've seen people putting in air purifiers. Would that help at all?
I mean, you would have to put it between you and your opponent. Their air, because I don't think that's going to make much of a difference, to be honest.
Yeah, fair enough. All right. So, is there anything, like, let's say it gets to the point where it seems like society is getting back to normal, gyms can start to open. How do you, like, is there anything we could do to minimize we're getting to the point now where we can reopen. I mean, maybe there's not 0 cases, but there's, I don't know. I don't know when that is. Like, what can we do as a gym to?
I suppose there will probably be a much lower tolerance for anybody coughing or sneezing. I think anybody with any symptoms would just have to stay away and wait till those are resolved and get tested. So that's probably the first thing. You could probably gel your hands or wash your hands before you come on the mat, or maybe have a shower before you come on the mat. But that might help as well. But I think that's not going to. You can't wash your lungs.
Nothing's gonna, obviously, like if someone walks in with it, nothing's gonna be perfect to stop it, is it? Like it's still, I mean, you might be taking off like percentages, but not.
Yeah, I mean, maybe if we washed our hands between rounds or something like that, or hand gel between rounds, but then our hands would be in
wearing face masks while we're rolling.
Yeah, yeah. That would make the chokes more interesting, but yeah.
Yeah. Okay.
I think that's just not practical.
Yeah. Okay. So we basically kind of have to. We almost would have to wait till it's completely disappeared before jiu-jitsu
I was
becomes
trying
a good
to think
idea.
about this. I mean, you certainly wouldn't want to have any community spread for at least 2 weeks, and I suppose then the brains in epidemiology in the country would decide what starts and what doesn't, and what's to what level. I mean, I suppose essential things will start up first. Things like shops and industry and things that are driving people's livelihoods would probably be the first to come back. And then I suppose the leisure industries would probably come in after that. But I'm not sure what criteria they're going to use or how they're going to make those decisions. That'll be a difficult decision to make.
I have seen someone talking about like a comment on Facebook. I thought you could address it. That assuming that like 60, that they didn't think it was possible that 60% of the population would get it. That like some people might have natural immunity. We just don't know anything about. Like, is that even a thing? Like, can people be immune to this, or like just by? Is that very unlikely, or what's your take on that as an expert in that field?
I don't know if I'm not an immunologist, but that's the whole problem with this virus is there's no pre-existing immunity. I mean, there's a bit of speculation that maybe that's why the kids aren't as badly affected, is because they have some maybe crossover immunity from some of the other coronaviruses. But that's, again, all to be proven. That's speculation. And, I think there just isn't any significant immunity to this. And that's why we're seeing the numbers we're going to see.
So the 60% thing is quite a probable.
I think that's if you don't take if you go down the suppression route, you hopefully wouldn't reach anything like that. But if you are just mitigating long term, and it might take a year or two to get to 60 or 70%, who knows? But yeah, that's probably the ultimate infection rate.
And what about? Sorry, I had a question. So right now, because I imagine there's, myself included, even though we don't have a gym to train at, like I would love to be able to get like a very small group together of people who are kind of taking it extremely seriously otherwise and still be able to train. But I don't know if that's a feasible thing or a good, like obviously from an outsider perspective, that's going to be a terrible idea, you're going to say, I think.
Again, I mean, it makes sense that you want to go back but limit the risk as much as possible. But I suppose it all depends how well isolated your partners are from, if you're just rolling with the 4 people who live in your house, that's probably okay. But if you're rolling with 4 people who go home to their partners and their parents, and that's
really about like how many, you almost want to take like the total exposure of people that like, if it's someone who is still going to work and being in contact with a whole bunch of people, and then they're coming and rolling with you, then and you're doing the same, then that becomes a really big problem. If it's people who were full-time jiu-jitsu coaches who now don't have a job and don't have to go outside, and it's just them catching up. But I mean, I suppose it's always risky. You would never advise for that, would you?
No, I think, no. I mean, maybe that would be the way when things settle down and you start going back gradually to, when things seem to have cleared, you start slow. But I'm not sure. That's not going to happen for a long time, I don't think.
He has thought about like renting a a house out in the woods, a big house, and invite some people there. We all quarantine ourselves for 14 days, and then just one person per week goes to get groceries or something, and it comes back, and just to be able to still train. But I don't know if that would would be feasible.
I think you couldn't tell anybody. I mean, that that might work if it was the same people for a month or whatever, and there was no external contact. But again,
it looks like it's just you and me, Liv. I think it's just us. All right, prepare for that. I keep saying I still haven't lost a round. I'm feeling pretty good about my jiu-jitsu.
Yeah, it's going to be interesting to see what it's like when we all come back, whether we'll put on weight and slow down, or we're all back to white belts or what.
Yeah. All right. So is there anything else? I'm just trying to go through. Is there anything else we haven't covered from that list? Do you have any further thoughts on this? Actually, at some point, I'd love to get you back on and actually talk about how we could prevent skin infections and staph throughout gyms. But I think it's probably not the time right now.
I suppose that is probably one of the few upsides of this, is any staph or ringworm that's going around is going to stop. That's the end of those outbreaks.
Yeah. Is there do you have any further thoughts on this, or anything else you'd like to say, or any messages you have for people in the jiu-jitsu community?
I suppose, first of all, it seems to be all doom and gloom, but there will be positives coming out of this. I suppose the most important thing is for people to isolate, people to wash their hands and do everything they can to protect their health systems and protect themselves. I think that cough etiquette, all the things you see the posters about and the ads, that is all crucial in terms of getting us through this. And I suppose, to try and finish on a more positive note, the vast majority of people will be absolutely fine. Like, it's 80% of people. But I suppose most people will know somebody who's badly affected by this or who doesn't make it out. But I think I've seen an enormous amount of cooperation and communication and organization as a result of this. It's certainly brought an injection of enthusiasm and resources to the health systems that haven't been there before. And, there'll be lessons learned from this. And I suppose, just like in jiu-jitsu, we thrive on adversity and we'll come back better and stronger. And we'll have learned lessons. And there will be advantages. I think there's going to be a lot more kind of teleconference type consultations after this, because we're trying to limit human contact, but still have some sort of outpatient appointments and things scheduled. So I think that sort of thing might stay with us after this is all over.
Yeah. If I can send a message to general jiu-jitsu students, if you're still in a position where you can manage to help your gym out, I'm pretty sure your gym's going to be in a pretty bad financial situation at the moment. So if you have the ability to continue to support the gym in some way, I hope they've got some sort of means of allowing you to do that. Then I strongly suggest that you do that. And obviously, I don't, if you yourself are out of work or in a bad position, then I think first look after yourself, and then if you have the means to, please continue to support your gym. For club owners, like, I would say, prepare for this to be there for a long time. Take it seriously, and potentially, if you are in a very difficult financial situation, maybe start looking for other work in the meantime, just to help keep going. It will go away eventually. We will be back to jiu-jitsu.
I think I've always felt it's been pretty hard to make a living out of jiu-jitsu if you're not Lachlan, Giles, or Craig Jones. But, and I've always admired the people who could. So, and a lot of them are struggling at the best of times, and it's, purely out of passion and their love of the sport that they continue. So then to have to deal with something like this on top of it, you can see how that would put so many people over the edge. So it is crucial for the students who can afford it to keep paying their dues if they can at all, because otherwise there may not be a club to come back to, as we've heard so many people say already.
Yeah, that's true. And I think that's a really important point actually for the student. Like, if you want your club, I think try not to put too much pressure on them to reopen early too, by actually supporting them while they're closed. I think if everyone cancels their membership and the club's struggling, they're actually probably going to be more incentivized to open it at what I think would be the wrong time and risk people's lives. So,
and I'm not sure how exactly it would work in Australia, but I would imagine if there is a case in your club when you reopen, you would be shut down pretty
it's going to be terrible
for another extended period of time.
Yeah, it'll be terrible if that happens. All right, I think that might be it. Huge thank you, Jérôme. That was really informative. Not good news, but that's kind of what I was expecting in speaking to you. Sorry.
Like I was saying, a lot of this is still in development. Who knows what's going to happen in the long run, but I think the most essential message is we just have to do this in terms of social distancing, washing our hands, coughing properly, so that we can try and keep the pressure off the health system, and so they can remain functional. And I think Australia is
sorry, just before I forget, I've got one more question. If you've had COVID and recovered, like, can you go and train? Like, is there any evidence that it would be a bad idea to go and train? Are you basically now you can walk around like a god, strolling the streets and
maybe you'd have a COVID gym that could just train away, but I suppose once you've had it, we're still not sure how long exactly you would shed it for. There's talk of maybe 2 weeks, and there's been some people who shed it for longer. And unfortunately, the test that they use is a PCR test, which detects the RNA or the DNA. I suppose in this case, it's the RNA, which doesn't necessarily equate to viable virus. So it's hard to know exactly how long we're infectious for. But I think in general, what we're saying is about 2 weeks from after the infection, so that you're infectious for. And that's kind of what we're applying to staff members staying off work. So in terms of the immunity,
I want to reiterate on that. It is not a good idea right now to try to get it out of the way and get it early. That is the terrible idea, and it will
because you're like,
just in case someone was thinking that's gonna help contribute to overwhelming the health system, and many more people will die if you do that right now. So do not do that.
If everybody does that, it's just gonna be disastrous. But in terms of the immunity, we still don't really know how long or how effective the immunity will be afterwards. So again, there is a chance that you could possibly be reinfected next year, but you would expect to have a much lesser infection. But who knows?
And I suppose the other thing to consider here is we don't actually know what the long-term effects are on people's health after they've had it, right? Like, some people may have lung issues, or we don't really.
I haven't heard anything about that. Yeah, certainly that'll be something to think about. I think generally after coronavirus, you'd expect to have a full recovery. But who knows what will come out of this in the long run? There might be immunological issues, or who knows.
All right. Thanks again, Jérôme. That was a really good chat. So, hopefully we get you back on again.
And hopefully we can get you back to Dublin again sometime when this is all over.
Yes, I'd love to get back there when we're in better days. And obviously, all the best. I really hope it's all just overblown somehow, but I don't think it's the case. But
I don't think so. I think we're heading into.
I hope you can get through, at the hospital, and everyone around can get through this as.
I think we definitely have probably the toughest month or two of our career ahead of us.
All right. All the best for that. Thanks, Jérôme.
Thanks a lot. Cheers, Lach.
Bye.